Welcome to the Field Notes podcast, presented by Seaworthy Functional Medicine. Seaworthy exists to help you overcome your complex health challenges so you can be fully vital. Now, here's your host, Dr. Rob Downey.
What are the root causes of picky eating, and what does that have to teach us about the current revolution in whole person care and functional medicine that's happening right now? Today, we are so fortunate to be joined by an expert, Lena Livinsky. Lena, thanks for your time today.
Oh, thank you for having me.
So, Lena is a speech and language pathologist and, as we noted, a true expert in this domain. And at the same time, the niche where you're working is very, very specific in terms of there's a bunch of things, just take one bite, all that stuff that any of us who care about picky eaters. And I love getting ready for today's topic because every single person listening has one or more kids in their life, either their children or their grandchildren or their friend's child or a kid in town or a kid at school. I mean, we
Mhm.
all have kids in our lives we love and care about that have this
Absolutely.
issue.
hmm
And yeah.
Yeah, the statistics are even, growing because of how toxic the world is and everything, and the chronic
Mm,
disease epidemic that's happening. Picky eating is definitely a big symptom of that. So
mm,
it's growing. Right now, the statistic I saw for typically developing children without any neurodivergence, that's about 25% of kids, so one in four,
mhm.
and I think it's rapidly growing. And when a child has other comorbidities, and neurodivergence that can even go up to 80% of kids. So it's a
Mm.
big issue, definitely. I think.
And just so I don't forget, is picky eating itself a pejorative? Is there a better term for that? I mean, are we stigmatizing kids by using that?
Yeah,
Like if they're listening to their bodies, is
that's
it
a
ironic at least that we're calling them picky eaters, but maybe they're picking up I don't know, the glyphosate,
yeah.
the
Maybe they know
Roundup.
more than they give credit for, right? They're
I
like,
don't.
this is not good for my body. I agree. I don't love the term. I use it
Mhm.
because parents can recognize it. They can
Yeah,
recognize what I'm speaking of. Sorry, my
yeah,
dog is trying to get into the office. But that's why I use it. But I think we can definitely think of better ways of explaining this term. Maybe
yeah.
selective eaters or,
Uh-huh.
kids who don't love every type of food there is out there. I don't
Yeah,
know. Or
yeah,
I think so. But I think picky eating just gives the parents an idea of what we're actually describing here. That's why I usually go with it. Because they're
right
like,
on,
I
right
know.
on. Well, the same thing happens in my area where uh, the term non-compliant patient is no longer
hmm
that. But at the same time, those of us that were trained during that era, it
Yes.
sort of resonated as an accurate sort of handle on what felt like a disconnect between
hmm
the plan. So anyhow, I love selective eating. Just I love language, but
Yeah,
I also am a believer in calling things what they are and using handles that make sense for the people that we serve. So
exactly.
there's so much cool stuff we can talk about today. It seems like the most important uh, typically, this podcast starts with a chance to kind of look under the hood of the thought leader around why this matters to them. Did
hmm
you find in your speech language pathology work you were sort of unsatisfied with the conventional approach, or how did you get to this point of uh, feeling that it was important to do it this way you're going to characterize for us today?
Yeah. Well, yes and yes. I definitely felt unsatisfied, and I still am in the field just because I think the field of speech language pathology is amazing because we can work on so many different areas of child's development. So it's a very beautiful field. However, we do focus very much so on the behavior aspect of things and how kids behave and what do they do. How do we change these behaviors? How do we set up the environment so they're going to act differently or maybe speak differently? And we also look at some skills. So we look at the swallowing skills, making sure the child can swallow safely, which is great. We also look at their oral motor development, the way that their muscles move, and things like that. So I feel like that's like the medical aspect of speech pathology. But everything else, it's very much kind of like behaviors and changing that and retraining the muscles, which is great. And I did use that approach for many, many years with my picky eaters because I was always in love with the field of feeding and feeding therapy and how kids eat and how do they swallow, how do they thrive, how do they grow. That always interested me. But, as I went through my schooling and as I went through different job sites and my training and I most of my CUs, so whatever continuing education I've done was always in feeding, a lot of it did discuss the medical aspect of things, but very minimally. And a lot of it was kind of like ABA therapy, let's train them to do this. And I did that for years, but once I had more clients and I started to see the limitations of this approach, I was like, well, I'm not really sure if this is what we're supposed to be doing all the way. I don't think we're addressing everything. But I didn't really understand it much. I mean, at the same time, I was learning a ton about holistic health and how the body works for my own personal health issues. So I was always a student of that type of mindset when it came to medicine. So I was learning a lot. And then I had my son, who was my biggest teacher in the world because he was picky. And
Hmm.
he continues to be. He has improved a ton, but I get to notice him in a very different environment than I did in the clinic with my kids. When I see them for 30 minutes and I get to talk to the parents, and we get to sit together and play for 30 minutes. It's very different when you have your own child and you get to go through every meal with them. You get to go through the ups and downs, and you get to see them for who they are. So that's when really things clicked for me because initially I was doing everything I was doing before as a feeding therapist. I was doing my behavioral approach and I found, I mean, I knew I'm his mom, not a therapist, so there were limitations there, but still, none of it worked. Like, none of it worked. And I started to observe him closer and I started to notice, this tension in his body and this fear around food
Mm.
and maybe not eating the foods I was expecting him to eat because he used to eat, and none of it was making sense to me. And then I took a step back and I was like, well, wait a minute. Why am I doing all this holistic healing for me and getting better and looking at things so differently for me? And how can I separate this one issue he's having from his body? So that's when I started to put the two and two together. I started to look at his biology. I started to look at his gut health. I started to look at his skills, sensory sensitivities around food, because I had pieces here and there that I was really looking at, but I wasn't addressing it. I wasn't addressing discomfort. I wasn't addressing nervous system regulation. So once I started to do that, things shifted very quickly for him.
So
And here we
cool.
are. Here we are.
Yeah, so
Yeah.
cool.
Yeah.
Yeah, the nervous system regulation and the signals of safety and feeling and being safe has become the probably the single strongest motif in my work because that's
Yeah.
very, very similar to where folks come in thinking they're stuck because they need to find the right supplement or something like that, just as an
Yeah.
artifact of the world we live in.
Mhm.
And most of them, it's nervous system dysregulation, shutting down
Wow.
digestion, immunity, fertility, etc. So,
Yes, the nervous system drives so much in our
yeah.
body, right? And like a child, for them to eat, and for us as well, we have to feel safe, we have to feel comfortable, we have to feel good, we have to
Mm,
coordinate swallowing and breathing and tolerate textures and engage socially at the table or in the kitchen. And nervous system regulation plays such a huge role here. If you're
yeah.
stressed, if you're in like this fight or flight mode, you can't rest and digest, right? Like you can't just enjoy your food.
Right.
Yeah.
Right. Yeah. And I don't think we're those of us kind of from Western industrialized countries or raised in the United States. I don't think we kind of have to come to that outside of grade school, high school, college, graduate medical professional training. There's this new emerging domain that's really interested in this physiology and the functions of the body, but there's a generation of us that wasn't part and parcel of how we were taught to
Yeah.
deliver care. So uh, we'll get to the call to action at the end, and people can work with you or learn from your website. but under kind of the proviso of our audience, who I thank for joining us, people are going to be really interested. Wow. So how does this actually work? Should we go into what parents do or what we do for kids we love and care about, or do we need to know more about where this is coming from, like the more specifics about the roots?
Yeah, well, I have a framework that I use when I work with a child, so I'm happy to talk about
Yeah.
that.
Thank
Okay,
you.
so of course, it's called the Bloom Framework. And I always imagine my Bloom Framework kind of like a blooming tree. And at the bottom, at the root of it is connection, right? Because when we're able to connect with our child, when we're able to help their nervous system regulate and calm down or feel seen, things start to really bloom and blossom. But Bloom stands for balanced health, learned oral skills, optimal microbiome, open exploration, and then mealtime boundaries. So, what I mean by that, I think we need to have balance, somewhat of a balance at least, in all of these areas in order for the child to be a healthy eater, right? Or an adventurous eater, feeling comfortable around the table. So, we look at the balanced health component, we look at any type of medical diagnoses or any type of issues going on within their health that could be causing discomfort when they're eating or stress when they're eating or affecting their eating in any way negatively. We look at their oral motor skills, making sure that they have the necessary skills to actually chew their food, to swallow it safely so that everything is kind of functioning properly. We look at their microbiome because the gut and brain connection is just so huge. We cannot overlook it here. So we look at that to make sure that the gut is balanced, there's no leaky gut, because if there is, oftentimes there is cravings for sugars and carbs, and that's going to very much dictate our diet, and it's going to negatively impact our appetite and digestion and everything else. So it's a very big thing here, and sensory regulation, right? A lot of times if there is an overgrowth in the gut, then we will have sensory issues. But that can also be from nutritional deficiencies, where we look at that for balanced health, right? Because oftentimes kids who are very low in zinc or have zinc depletion, they will have sensory sensitivities around food and other areas as well. So there's different nutritional deficiencies we would look at. We look at open exploration because we want our kids to feel comfortable when they're exploring, right? We want them to have a lot of opportunities depending on where they are with their eating, whether that is even going to the garden and playing with the food there, picking food from the garden, going to a grocery store first and discussing different foods that are available there, or maybe having them pick something out, or just having them help you at in the kitchen, getting the food ready. There's many different stages you can do this in, many different ways you can do this in, but depending on the child and where they are in their readiness trajectory right now. And then the last one is boundaries, because we need to have boundaries about what we expect of our kids, where we're sitting, how we're eating, how long they're expected to be there. Boundaries are really healthy for kids without, of course, trying to set them up for failure, without stressing them out. Just boundaries that are healthy, and so the kids know their expectations, right? And I think when we look at all these areas and we're able to zoom out and see our child in this kind of lens, we can really start to figure out where is the disconnect, what is happening, so that we can help them become more adventurous around food.
So cool.
Yeah.
I'm sure a bunch of our audience is just all lit up right now thinking, wow, this makes so much sense. This is so
Oh,
much
I hope
better.
so. Yeah.
Yeah.
I,
Yeah. By the
I
way, picky eater in recovery. Full
oh,
disclosure.
love it.
So,
That's
yeah.
great.
Yeah. The early in my life, I was in Sri Lanka, which was then called Ceylon. My dad was a
Yeah.
dentist and had four older siblings, and so we were over there for a year and a half. He was teaching dentistry for a project called the
Wow.
Hope Ship,
That's
and
really cool.
my mom told me I lived on rice and bananas.
Oh yeah. Oh yeah. Red flags right there. I wonder why.
Right. Uh, so there's a whole bunch of things I'm super interested to learn more about, but one of the ones I think is a logical segue is then how let's talk about kids feeling safe. Let's talk about the nervous system regulation, the specifics. Those of us who want to show up for kids, what are the action items for adults to
Yeah.
make that a reality
Yeah.
for them?
I really think it starts with connection, right?
Mm-hmm.
So you kind of take a step back and you really connect with your child where they are. You observe them.
Mm-hmm.
Maybe, you're planning this beautiful meal for dinner, and dinner is like the most stressful time during the day because everybody's getting home from school. You're rushing to get it ready. You're watching your child. Maybe they had a hard day at school. Like, kind of like taking a step back to watch them and meet them where they are, I think can be so regulating for the child, right?
Mm-hmm.
Because you can, depending on their age, if they're 3 or 2, maybe they missed you because they didn't see you all day. So what do they want? They want some one-on-one time with mom,
Mm-hmm.
maybe, or and dad. Maybe they want a hug. Maybe they want to play. Maybe they
Mm-hmm.
want to show you a toy or something. So just
Mm-hmm.
taking a step back and giving them the time of day to actually connect that way, it is so powerful. And
Mm-hmm.
especially doing that, I think before meals. So
Mm-hmm.
that signals to their body like, oh, like this is my person. My person's here. I'm safe. I can do this, right? And even with older kids, the same thing. You kind of talk to them about school, talk to them about something that's been on their mind or that they're interested in, kind of find this way to connect with them, to help them feel safe and grounded. I really love that. And then there's many different ways you can do that as well, depending on what meal are we talking about, what time of day we're talking about. Maybe before dinner, if it's still sunny out, everybody goes for a walk and gets sun exposure. This is so regulating to our nervous system. It is so good for us to be outside and ground a little bit. Maybe go touch a tree. I don't know what you're into. I'm into that. So I love that stuff. But all these things, I think they're so regulating, and finding ways to fit that into your daily routine so it doesn't feel overwhelming for you as a parent who's already
Mm-hmm.
doing so much and is being stressed out because of the picky eating issue.
Mm-hmm.
I think that can be gold. And it doesn't mean you have to do an hour. Just connect for a few minutes and see
Mm-hmm.
how that's going to affect your child at the table.
Mm-hmm. Yeah, I should briefly share to just sort of add to and underscore what you're sharing. Uh, One of the things I see over and over again is the assumption will be, oh, such and such has to happen. Dinner has to happen and be organized so that then we can get to after dinner. So then we can get to
Mhm,
and and what I would observe, and this is for myself as well, is when we respond that way to our kids or dinner, just since that's the example we're using, we're not in the now. We're not present.
mhm,
We're
mhm,
already future tripping into pre-bedtime and hoping that'll go well. And our kids sense, as a parent of two, kid young people in their early to mid 20s,
mhm,
uh, I've got firsthand experience with this, but I was absolutely blown away when somebody taught me. They said relationship itself is the single most powerful aspect of parenting. And they
mhm,
said the single most powerful thing you can ever do is to hear your kid, not tell them something. And
mhm,
as I put this into action, I really flashed on that while you were talking. Hey, how are you doing? What's going on? Who'd you see today? Even
mhm,
if they don't want to talk about it specifically, but just being present, especially the phrase, I hear you.
mhm,
Tell me more. I hear you. Tell me more.
mhm,
I think our listeners may be blown away if this is an issue that some some child who's part of your life matters. You may be blown away by just what Lena said, just doing that, just being present,
mhm,
getting grounded, and then thinking what am I present in my body? Am I present in the moment? Am I there for my kid? Isn't it great if we spend 5 minutes connecting and then the whole rest of the evening
Yeah,
goes goes better? There's some magic here.
so much magic. Yeah, yeah. I mean, when our children are like securely attached to us, we start that from the beginning of when they're born, right? We start with feeding them, maybe nursing, maybe the bottle, and we look into their eyes, and we're there when they wake up, when they're sad, when they're in pain. We're usually the person to go and answer that cry. So, even though they need us less as they get older, they still need us. And that
Mhm.
attachment forward parenting, I think it goes for their entire lives. And it's so important. Even if it's like you said, a moment of connection, it's going to just help them regulate so much to be
Mhm.
with, to feel like they're seen, they're heard, they're cared for. It's just our biology. We need that. We really need
Mhm.
that as a species. So that is really helpful when it comes to feeding for sure.
Mhm. Another thing I flashed on while you were talking is that there's there's this really important thing that happens in functional medicine for people who are working on being overweight or obese, which is this conversation about the microbiome, the gut-brain connection,
Mm-hmm,
and having people stop beating themselves up.
hmm
And so if a child or young person has a dysregulated or unbalanced microbiome, and the gut-brain connection is looping
hmm
in a dysfunctional, unproductive way, uh, it's so inappropriate and unfair to blame the kid for basically a looping communication pathway that we have an obligation to show up with the things you're going to teach us about to rebalance the microbiome. In your clients and patients, is this done empirically or is this done via testing or both? How does that play out?
Yeah.
Because parents really struggle with, especially there's so much in podcasts now and
Mm.
about gut testing and all that stuff, but there's so much we can do empirically to correct the microbiome.
Absolutely. So for me, because I'm not a medical doctor, so I love to work in conjunction with like an integrative pediatrician or
Mhm.
somebody who, if parents want extensive testing, they can definitely get it done. We could do a gut health test, whatever is needed, look at their nutritional deficiencies. I think it's great. However, like you said, I think there's so much we can do at home just to help our gut regulate more and to get rid of some of those deficiencies or overgrowths. I myself, I'm a fan of, I don't know if you have heard of Mary Ruddick, but she is an ancient nutritionist. She has traveled the world and she has done studies or she has learned from indigenous tribes, people who have perfect health, right? People whose microbiome is perfect, and she's looked at that. But it's incredible because I really love her microbiome advice because this is what she specializes in. So feeding your birth microbes, I think it's so important, right? Looking at foods that actually feed your birth microbes because so many of us, as we go through life, our gut unfortunately suffers because of antibiotic use or because of glyphosate, because of poor diets, ultra processed foods, and because of non-native EMFs, our light environment. We now know that the light environment actually shifts our microbiome a little bit more than food does. So there's so many things to consider here. So feeding the birth microbes, which are so important for our health, looking at the diet to eliminate some of these gut disruptors there and replenish with some really good foods. I love a meat stock with based on food is so good. It's so healing. Lots of collagen, lots of gelatin and nutrients. Like I love that.
Mm.
I use that to help me with my gut. That's why I'm a big fan. Look at the light environment, right? Get rid of some of that blue light disruptions and go outside, get in the sun as much as possible. There's so many things we can do to shift at home without the need of a ton of testing, which I think it's
Mhm.
nice to know, but there's definitely things we can do at home to help
Mhm.
a lot.
Mm. Awesome. So great.
Yeah. Okay, good. I was getting so nervous. I'm like, do you agree with my advice?
Oh, oh, yeah. I'm so fortunate. I get to meet my tribe every time I get to do the podcast.
Yeah.
And
That
and
makes sense.
so it's an editorial comment our audience might find interesting. There's there's such a coherence now in the emergence
Hmm
of the salient information showing up in multiple domains with multiple experts. The
Mhm.
same really, really interesting and important topics are showing up again and again and again. The light, the circadian regulation, the gut-brain connection. And it's been, if somebody had told me how important it would be to my life and the lives of my patients, these things that were not part of how I was raised,
Mhm.
just raised in a very mechanistic, sort of the body's a machine type way.
Mhm.
Uh, Mostly it makes so much sense to me when we think of the body like an ecosystem in nature rather than a machine. These things make so much sense. The
So much.
light, the rhythm to things, all of the different inputs. Um, and this issue again of just our genetics, our physiology being based on pre-agricultural people, then
Yeah.
ancestral food plans, feeding the native microbiome, the early microbiome, the birth microbiome.
Mhm.
There's a ton of leverage here. It's like we're turning on hardware and software that's our birthright,
Yeah.
and then these amazing cascades are turned on, and the
Mhm.
benefit is nearly endless because another benefit of not being mechanistic, if you get more clean water in an ecosystem or enough sunlight or the right creatures, a diversity of things happen, not just one thing. That's part of why people are so dissatisfied with conventional medicine is you start
Yeah.
a blood pressure drug, your blood pressure goes down, but your mood
Yeah.
doesn't improve or your restorative sleep or the degree of connection with your spouse or your kid.
Mhm.
So there's just a shocking amount of power in this stuff. A lot of what I run into too is some of my patients or people interested in this. I think they've gotten fatalistic. They can't even believe that it could be this simple and this beautiful. So I
Yeah.
think it's also important to take a risk with some of these things and say,
Mhm.
great, why not? If I can afford to or access the resources, why not switch the lighting in the household in a sensible fashion or
Mhm.
create safety or go out and touch a tree and just see if it helps my kid?
Mhm. Mhm.
Because that mechanistic thinking has bled into a degree of fatalism that, everything's a mess, which is not the real circumstance.
Right. It's not how it's supposed to be. I mean,
Yeah.
at this point, we're having like third generation C-sections too, right? I just feel
Hmm.
like we have kind of went the wrong way so much when it comes to our health that, we're having this beautiful comeback because we don't have any other choice. There is no
Hmm.
drug that is going to help that,
Hmm.
unfortunately. And, and on the other set of spectrum, like you said, it's the kind of the closer we get to nature and the natural rhythm of life and how we evolved as humans, the closer that will bring us to health.
Mm, yeah, the body knows the way. I saw
Mhm.
a really powerful documentary. I think it's called Serengeti Rules. I hope everyone will forgive me if I get it wrong. But it just talked about how if you bring back a keystone species in an ecosystem, the amount of ecosystem recovery is way out of proportion to expected. So I think in where I live, it's like sea stars versus urchins, but the degree to which the body can knows the way back is way out of proportion to what we might think. So there's some really good news here and really important reasons not to be fatalistic. When we do sensible things, the body so much wants to get back on track.
Yeah.
It often, we or our kids often do much better than expected in response to the right inputs.
Absolutely. We do. And everything kind of happens in layers, right? I
Hmm.
feel like sometimes we just go for like, no, but I want this to be the end goal, which is
Hmm.
great. And hopefully we'll get there. But everything happens in layers. Healing is not linear in any way.
Yeah.
So,
Yeah. Yeah, it goes back to I just want to make sure and just speak for myself on this one, but uh, this I unfortunately I think one of the problems is around power and control. It's a
mhm,
hassle
mhm,
negotiating with these behaviors. And so on some
mhm,
level, I think some parents or grandparents or what have you, they just want the problem fixed. We have
mhm.
to love the problem for it to get better. And that includes recognizing these
Yeah.
young people at whatever age, when we're inviting them to have the toolkit to have a sensible and loving relationship with food and friendships with food, we're going to have to create a nurturing situation to invite them into that. And we're going to have to do some work to let go of our power and control issues if we really want it to come out well.
Definitely. Yes. I always, yeah, I think in order for us to really work on these deep-rooted issues that we're having, is like we have to change the environment, whether it's comfortable for us or not, but we do. Without the environmental changes that need to happen, unfortunately, healing will be very difficult.
Hmm.
Yeah.
Well, what other things do you have to share with us that we haven't talked about yet? Do you have some other, um, big items that have this feeling of I definitely should, get this out there so people know about it?
Yeah, I think what's really important, especially for caregivers who know something's wrong, but they're going to the pediatrician's office and they're like, this is normal, like picky eating is normal. And we hear that quite often, unfortunately, because um, a lot of physicians or well-meaning physicians or people who are in your circle helping you, they may not know. So if you have this feeling in your gut and you're like, oh, it doesn't feel normal, this has been going on for a while. They're really eating not that many foods, or maybe they're gagging or choking on their food. Maybe when I'm brushing their teeth, I'm finding a piece of steak in their mouth after 3 hours after dinner, right? Is this normal? Maybe it's not normal. So I would really encourage everybody to listen to their guts. And we talked about the gut-brain connection, right? This is where we process a lot of our emotions there. We just know. I would seek other advice, right? If you
Hmm.
feel like it's not a good match, they're not really understanding my issue, they're just telling me it's normal, you can go look for a different pediatrician. You can come talk to me. We can talk about it. You can find somebody else because I do think feeding is very much an interdisciplinary area. It's not, it's rare to have like one person help you with everything you need. It could happen, but oftentimes like you need to have a tribe of people who can really help you.
Hmm.
Yeah.
Yeah, I think we all know when we have the right resource. I wonder if it's really similar to when we know somebody might become a good friend. I
Yeah.
was I was just reflecting this last week on somebody I've known for 25 plus years. And I remember the night I met that person. I
Hmm.
just had this feeling, wow, this is a
Hmm.
really cool person. I really trust this person. There's an
Aw.
expansiveness and a sense of safety to
Yeah.
this. And I think it's such a relief to folks that you'll know and go ahead and keep searching and seeking uh till you find the resource.
I
I
think
think
so.
folks are afraid. Maybe
Yeah.
it's again that just oh the default circumstances we start from. The 1.0 version is sort of trust the expert. You're not trained in this, so maybe you don't
Mhm.
know what you're doing. And I think the opposite is actually true. We can feel it when we're on the right track.
Yeah, absolutely. And it's okay to question things. I feel like sometimes we, depending on where you grew up or how you grew up, we're taught to trust the authorities and just not question the authorities, which we have kind of seen over and over and over again. That shouldn't be the case. You should really listen to your gut, trust your gut, in terms of how you deal with your own health, but also your children. So if anything stands out to you where you're like, well, I don't think that's right. It's okay. It's okay to change your office. It's okay to go look for somebody else to ask for
Hmm.
advice because ultimately our kids want to eat, right? They
Hmm.
do. This is
Hmm.
one of the biggest pleasures of our lives is eating, and it's such a social engagement. I mean, so much happens in our life around food that we don't sometimes don't even realize, right? Because we get to do it usually sometimes on our own, but oftentimes with in a group, in our tribe, in our community, with our friends, with our family, with people in a restaurant who are sitting around you. So it's a really important skill, but also right to have. And kids want to eat, right? And once their bodies feel safe and they're feeling comfortable and they're feeling, you know, okay to put something in their mouths and okay to get this nourishment, magic can happen, right? It's just giving them the right tools to heal these areas that are kind of out of balance, and that's what's really going to move the needle in this direction because they want to eat. We all do. I
Mhm.
mean, eating
Yeah.
is our right. It's
Yeah.
our second most important. I mean, that's what I learned. Second most important body function that we have, right? We need to eat to survive. After breathing, it's eating. It's important.
Yeah. Yeah. Thank you.
Yeah.
Any other wisdom that you'd like to share
Um,
today?
Yeah. You know, even if your child is much older, even if you feel like you have failed or you didn't do the right things, it's never too late. Of course, the earlier you address this, the better, usually the easier, but it's never too late. It's never too late to make little changes in the environment, little shifts, and it doesn't have to be overwhelming things in your life or in your home where you have to move your house and change everything. It doesn't necessarily look that most of like that most of the time, unless there's things in the environment like mold, things like that. But usually it's little changes that don't have to overwhelm you or change your entire routine that are going to start to move the needle in the right direction, regardless of
Mhm.
age, right?
Yeah.
And whenever you're in doubt and you're like, I have no idea where do I even start? Go back to that tree trunk, to the root of everything, go back to connection and start there. Start to observe your child, and you'll be surprised how much you're going to start to notice.
So cool. So cool. What a great
You.
conversation.
I loved it too. Thank you.
As we got ready for today, you noted that people can find a lot of wonderful information and illumination on your website, but also that they
Mhm.
can work with you
Yeah.
directly. Is that accurate?
Absolutely. That is accurate. My website is lenalivinsky.com, and I have a lot of free resources. And I also have a root cause quiz that takes about 2 minutes and it goes into the different areas of bloom. So they can kind of see maybe like where should they start if they're not sure, or there's like a few tips too, of what you can start at home, like two little things or three little things you can do in different areas so it can kind of guide you in the right direction if you want to get started. But yes, I definitely still take on one-on-one clients, so they can even book a call with me, a free call with me, so we can kind of see if we're a good match to work together. Because I always like to have a conversation first to make sure. Because I am definitely on the holistic oriented trajectory here. Like I'm very holistically oriented. So I will talk about things like light. I will talk about things like the gut microbiome. So the person who works with me has to be willing to kind of make these changes and to
Hmm.
incorporate these things into their everyday life. So I always have that conversation to make sure we're a good match.
Beautiful.
Yeah.
Well, thank you so much.
Thank you for having me. This was so great.
Hope you have a great rest of your day.
You too. Thank you.
Thanks for joining us for the Seaworthy podcast. Seaworthy exists to help people overcome their health challenges and be fully vital. If you think we've earned it, please consider giving this podcast a like, subscribing, and giving us a 5-star rating on the platform of your choice. Thanks.